10 symptoms of pancreatic cancer that will shock you. Vertical bar critical warning signs. Vertical bar. Healthy care pancreatic cancer is often called the silent killer, and for good reason. Hidden deep within your abdomen, the pancreas quietly regulates blood sugar and produces enzymes critical for digestion. But when cancer strikes this small organ, it often goes unnoticed until it's too late. In fact, pancreatic cancer is one of the deadliest forms of cancer worldwide, with a 5-year survival rate of only about 12%. In the US alone, it takes over 65,000 lives every single year. The frightening part? Nearly 80% of patients overlook early warning signs, thinking they're dealing with simple digestive upset, fatigue, or aging. Yet research shows many of these symptoms appear 3 to 6 months before diagnosis, offering a rare window for early detection. Even more remarkable, spotting just 3 of these symptoms together can increase the chances of catching pancreatic cancer early by nearly 70%. Today, we're going to reveal 10 critical warning signs of pancreatic cancer. Some are subtle, some are shocking, but all of them could be life-saving if recognized in time. 1. Digestive problems and unexplained weight loss. One of the earliest and most overlooked signs is digestive disruption. When tumors block the pancreatic duct or interfere with enzyme production, food doesn't break down properly. This leads to persistent nausea, vomiting, bloating, and loss of appetite. Over time, the body can't absorb nutrients, resulting in unintentional weight loss, muscle wasting, and nutrient deficiencies. A classic red flag: pale, greasy, foul-smelling stools caused by undigested fat. Many dismiss this as just stomach trouble, but it may be your pancreas sending a desperate warning. 2. Persistent fatigue and weakness. This isn't ordinary tiredness. It's a deep, relentless exhaustion that doesn't go away with rest. Pancreatic cancer cells compete with healthy cells for nutrients, draining your body's energy reserves. Even climbing stairs or lifting light objects may feel overwhelming. On top of this physical drain, emotional fatigue, sadness, and poor sleep make the exhaustion worse. Unlike normal tiredness, this fatigue is constant and slowly intensifies, a clue that something serious may be happening inside. 3. Fever, night sweats, and chills. Pancreatic cancer can trigger inflammation, confusing the immune system and causing sudden fevers and shivering episodes. Unlike a simple flu that passes in a week, these fevers linger, return, or fluctuate without clear cause. Night sweats, alternating chills and heat waves, and overall discomfort may accompany them. If these irregular temperature spikes persist, they should not be ignored. 4. Dangerous blood clots. Few people realize that pancreatic cancer can alter blood chemistry, creating a state of hypercoagulability, where blood clots form too easily. This can lead to deep vein thrombosis, DVT, usually in the legs, with swelling, warmth, tenderness, and discoloration. The real danger comes if a clot breaks free and travels to the lungs, causing a pulmonary embolism. Symptoms include sudden shortness of breath, sharp chest pain that worsens when breathing, and a rapid heartbeat. Immediate emergency care is vital, because minutes can mean the difference between life and death. 5. Enlarged gallbladder or liver. When tumors block the bile duct, bile can't drain properly. This causes the gallbladder to swell and the liver to enlarge. Doctors often detect these changes during physical exams or imaging scans, but sometimes the swelling can even be felt beneath the rib cage. This chain reaction between organs is one of the pancreas's most telling warning systems. 6. Persistent bloating and gas. We all get bloated sometimes, but bloating linked to pancreatic cancer is different. Patients often feel unusually full after only a few bites of food, a condition known as early satiety. This happens when tumors press against the stomach or intestines. The bloating is stubborn, unrelieved by antacids or diet changes, and may persist all day, every day. If this kind of fullness lingers for weeks, it deserves careful medical attention. 7. Abdominal or back pain. One of the most distinctive symptoms is a dull, persistent ache in the upper abdomen that radiates to the back. Some describe it as a gnawing or heavy pressure. It often worsens after meals or when lying flat and becomes more constant as the cancer progresses. While back pain has many causes, its specific combination with digestive changes should raise red flags. 8. Dark urine and jaundice. When bile can't flow normally due to a blockage, bilirubin builds up in the body. This causes urine to turn dark yellow or brown, similar to cola or strong tea, even if you're drinking plenty of fluids. Soon after, the skin and eyes may take on a yellowish tint, a classic sign of jaundice. Importantly, urine discoloration often appears before visible jaundice, making it a crucial early sign. 9. Loss of appetite and taste changes. Pancreatic cancer doesn't just steal your appetite, it can also change your sense of taste. Foods you once loved may suddenly seem unappealing or even unpleasant. Many patients report that meat or fatty foods taste different or cause discomfort. Combined with digestive distress, this leads to eating less, accelerating weight loss and malnutrition. 10. Sudden onset of diabetes or blood sugar changes. Because the pancreas regulates blood sugar, tumors can interfere with insulin production. For some, this results in the sudden onset of diabetes or unexplained fluctuations in blood sugar levels. If you're over 50, have no history of diabetes, and suddenly develop it, especially alongside other symptoms like fatigue or weight loss, it may be more than coincidence. Doctors are now recognizing this as a potential early warning sign. The bottom line: pancreatic cancer is a master of disguise, often mimicking common, harmless problems like indigestion, fatigue, or back pain. But taken together, these symptoms are not ordinary at all. They are your body's quiet alarms. Recognizing even a few of these warning signs, dark urine, unexplained weight loss, constant bloating, or back pain, could provide the precious time needed for diagnosis and treatment. Knowledge is power, and awareness saves lives. If you found this information valuable, please share it widely. Someone you care about might recognize these signs just in time. And don't forget to subscribe to Healthy Care for more life-saving health insights. Because awareness today could mean survival tomorrow. Because awareness today could mean survival tomorrow.
Pancreatic cancer's terrifying reputation doesn't only come from its aggressiveness, it comes from its ability to stay hidden until it's too advanced. Unlike breast, prostate, or colon cancer, where regular screening tests can catch problems early, there is currently no widely available routine test for pancreatic cancer. This means that by the time most people notice symptoms, the disease has already spread beyond the pancreas. One of the biggest challenges is the pancreas's hidden location, deep within the abdomen, behind the stomach, and close to major blood vessels. Tumors can quietly grow for months or even years before pressing on nerves, ducts, or organs enough to trigger discomfort. This anatomical camouflage is why many doctors call pancreatic cancer the disease that whispers. Beyond anatomy, let's consider the risk factors, those silent forces that, without you even realizing it, increase your odds of developing this cancer. Age and genetics. Most patients are diagnosed after the age of 60, but genetic predisposition can lower this threshold dramatically. Having a family history of pancreatic, breast, ovarian, or colon cancer raises your risk. Specific inherited mutations such as BRCA1, BRCA2, or Lynch syndrome are now recognized as strong predictors. Chronic pancreatitis. Long-term inflammation of the pancreas, often caused by heavy alcohol use, gallstones, or high triglycerides, damages pancreatic tissue. Over time, these changes create fertile ground for cancer cells to develop. Smoking cigarettes nearly doubles the risk of developing pancreatic cancer. Carcinogens found in tobacco, they enter the bloodstream and accumulate in the pancreas, where they can damage DNA and trigger uncontrolled cell growth. Diets that are high in processed meats, fried foods and sugar tend to increase insulin resistance and chronic inflammation. Excess abdominal fat also seems to directly stress the pancreas. When you add a sedentary lifestyle into the mix, it really creates a sort of metabolic storm that can foster tumor development. Diabetes is both a risk factor and, in some cases, a consequence of pancreatic cancer. The relationship is, honestly, quite complex. Long-standing diabetes can put stress on pancreatic cells, while sudden onset diabetes in older adults may actually serve as an early warning sign of an underlying tumor. Another reason pancreatic cancer is so hard to fight is its aggressive biology. Pancreatic tumors grow rapidly, invade nearby organs early, and release chemicals that help them evade the immune system. They also encourage the growth of scar tissue around themselves, making it harder for treatments like chemotherapy to penetrate effectively. The combination of these factors, hidden anatomy, vague early symptoms, lack of screening and aggressive biology, explains why pancreatic cancer has such a low survival rate compared to other cancers. But here's the silver lining. Understanding your personal risk and monitoring even subtle symptoms can make all the difference. People with family history, unexplained diabetes, or chronic pancreatitis should work closely with their doctors for early imaging or genetic testing. This is not about fear, it's about awareness. Knowing the silent risk factors gives you a head start in protecting yourself and your loved ones. The truth is, while pancreatic cancer is deadly, knowledge and vigilance are the best defense against its silent progression.
Lifestyle, nutrition, and early screening that could save your life. While the statistics around pancreatic cancer are grim, research shows there are practical steps you can take to reduce your risk and improve your chances of catching it early. Small changes in lifestyle, diet, and medical awareness can have a profound impact. First, let's talk about lifestyle habits. Smoking cessation is perhaps the single most important choice you can make. Studies show that former smokers steadily lower their risk over time, and within 10-15 years, their risk approaches that of non-smokers. Similarly, maintaining a healthy body weight through regular exercise not only reduces inflammation and insulin resistance, but also helps keep your pancreas functioning efficiently. Next, nutrition. Your pancreas thrives when you fuel it with whole, nutrient-dense foods. Diets rich in colorful fruits, vegetables, nuts, seeds, and fatty fish provide antioxidants and omega-3 fatty acids that fight chronic inflammation. On the other hand, heavily processed meats, fried foods, and sugary beverages should be minimized, as they place unnecessary stress on your digestive and metabolic systems. An overlooked but crucial factor is alcohol consumption. Heavy long-term drinking is strongly linked to chronic pancreatitis, which in turn increases cancer risk. Moderation is key. If you drink, keep it minimal. And if you already have pancreatic or liver concerns, consider cutting alcohol out entirely. Beyond lifestyle, let's look at medical vigilance. Since there's no routine screening test for the general population, early detection relies on paying attention to changes in your body. Imaging tests such as MRI, Connecticut scans, and endoscopic ultrasound are powerful tools, but are typically reserved for those with strong family history or genetic predispositions. If you fall into this category, discuss with your doctor whether you qualify for specialized screening programs. Another important frontier is blood biomarkers. Researchers are studying CA19-9, a tumor marker often elevated in pancreatic cancer. While it's not reliable enough to use alone, in combination with imaging and genetic testing, it offers a glimpse into future detection strategies. Scientists are also exploring liquid biopsies, simple blood tests that look for tumor DNA fragments, which may one day revolutionize how we catch this cancer. It's also important to emphasize the role of gut health. A healthy gut microbiome supports your immune system and reduces inflammation throughout the digestive tract, including the pancreas. Probiotic-rich foods like yogurt, kefir, sauerkraut, and kimchi, along with fiber from vegetables and whole grains, create a protective environment. Ultimately, prevention and vigilance come down to balance: quitting harmful habits, adopting nourishing foods, staying physically active, and keeping close communication with healthcare providers. While we can't change our genetics or family history, we can absolutely influence many other risk factors. The most powerful weapon against pancreatic cancer isn't just medical treatment, it's awareness. By knowing the symptoms, understanding your risks, and making healthier choices every day, you give yourself the best possible chance of early detection and survival. If you found this information valuable, consider sharing it with someone who might benefit. And if you'd like to continue learning about life-saving health insights, don't forget to subscribe to Healthy Care, leave a comment with your thoughts, and follow our channel for more important updates. Your engagement not only helps us grow but also spreads awareness that could save countless lives.